Have you ever felt your heart race before a big presentation or worried intensely about a job interview? That familiar knot in your stomach, those restless nights before a major event, are certainly common experiences many of us can relate to. The main difference between normal anxiety and an anxiety disorder is about intensity, duration, and impact. Normal anxiety is a temporary feeling of worry or fear, often triggered by a specific event or stressor, that eventually subsides. In contrast, an anxiety disorder involves persistent, excessive, and often uncontrollable worry or fear that is disproportionate to the actual situation and significantly interferes with daily life. Think of normal anxiety as your brain's helpful alarm system, alerting you to potential danger so you can prepare. With an anxiety disorder, that alarm system becomes oversensitive, frequently sounding off even when there is no real threat. This can manifest as constant dread, feelings of impending doom, or an inability to relax, far beyond what the situation warrants. The why behind this often involves a combination of genetics, brain chemistry, and environmental factors, leading to a dysregulation of the stress response. So, how can you tell if what you are experiencing goes beyond everyday worry? Pay attention to a few key signs. If your anxiety is severely disrupting your work, school, or social life, making it hard to concentrate or engage in activities you once enjoyed, that is a significant indicator. Also, notice if the physical symptoms of anxiety, like a racing heart, shortness of breath, trembling, or stomach problems, are frequent and intense without clear cause, rather than just occasional responses to stress. It is also helpful to consider the scope of your worry. Normal anxiety usually focuses on a specific, immediate concern, like an upcoming deadline. Anxiety disorders, however, often involve generalized worry about many different things, or specific fears like social situations or panic attacks, sometimes seemingly out of the blue. Conditions like generalized anxiety disorder, panic disorder, or social anxiety disorder are diagnosable mental health conditions, not just a case of feeling a little stressed. Understanding these differences is not about self-diagnosis, but about recognizing when it might be time to seek support. If your anxiety feels overwhelming, uncontrollable, or is negatively affecting your quality of life, reaching out to a mental health professional can provide clarity and effective strategies. Just like any other health condition, anxiety disorders are treatable, and relief is absolutely possible, allowing you to regain control and enjoy a more peaceful life.